Welcome back, everyone. We all want to look our best as we age from head to toe. Many of us hope age to be age-defying pretty much every step of the way. But when does it get to be just too much? Here to break it down is facial plastic surgeon Dr. Mark Beaty, Lil, our dear friend, Lil Dyer-Cobbs from Seraphim Skincare.
Aging gracefully.
That's graceful. That's graceful.
And Kiana dancing. Oh my God, welcome back, Kiana.
Thank you for having me. I appreciate that.
Reality star, you name it, she is. And we're glad to have you back. But I wanted to talk about this just because I think we can't get away from it. And, you know, when you think about, I want to start off with you, Doctor.
Sure.
People come to see you. This is your career. I mean, people are coming to see you to look their best, to feel their best.
Right.
What are you seeing, or what have you noted in your last, how many years have you been in practice?
I've been in practice 20 years.
Wow, so you've seen it all, I'm sure.
Absolutely, and what we've seen is a tremendous amount of change over those 20 years. Part of it being some of the things you brought up about the pressures on people to look their best, and to for that plays into their social lives, their business lives, all aspects of what people take on. Yet we're also under pressure to do things in shorter and shorter amounts of time.
Right. Yeah,
So-
because we can't have that downtime of surgery. Right. I got, you know, we've got to be going. I can't take a week off of work.
So fortunately, our technology has gotten dramatically better in the last 20 years, which offers the opportunity of doing many things with much shorter recovery times, from surgery to less invasive procedures.
Right.
So, you know, we have more offerings for people, which is really exciting.
Yeah, it is exciting. Are you finding that people are getting younger and younger that are wanting these procedures? What are you thinking?
Actually, it's interesting. I think that the demographic has expanded on both ends. On the one hand, you have younger millennials who are trying to be at their absolute best from the very beginning, and to try to prevent some of the aging changes that they may have seen in cohorts ahead of them. And then you have older people who are wanting to stay in the workforce for longer, because why not? We are healthier, we are capable for longer periods of time.
Sure.
So helping them to look as good as they feel and look as good as they can perform has become more and more important for us.
Okay, and that's a great point. And I want to turn to Lil, and Kiana, I'll get to you too in a minute. Lil is the epitome, in my humble opinion, of aging gracefully. She runs this beautiful spa, and your focus is on, you know, not obviously not surgery or anything like that. You're talking about products and things to make people look and feel their best, right?
Well, being 62, what I know about skin is retin-A, and I had very damaged skin, will get you all the way through your 50s.
Yeah.
There comes a point where, and I had it done, I don't mind telling anybody, the jowls start, retin-A won't prevent the jowls.
Right.
They'll put them off for a long time. And it's almost like the hem coming out of a dress.
Oh, right. God.
And it's like,
I can't wait. I know, I'm already getting it. I can't wait.
Hanging.
Exactly. You want to pull the hem up a little bit, which I did do. And then all the years I baked in the sun in Atlanta and Florida, going to school, college in South Georgia, there were some deep lines that crept up that weren't there all through my 50s. So I did have the laser, and that's a pretty powerful thing. And
were you scared? I mean, when you think about, because here you are representing yourself and your business, were you afraid to do something?
I was not afraid, because I trust the doctors.
Yeah.
I do. What I don't like are the results I see of people who do their lips too much.
Yeah.
I want to look just like I did. You know, if I run into someone I haven't seen since kindergarten, I want them to know it's me.
Right.
Yeah.
Amen.
It's like resetting the clock, right?
Yeah.
That's
Yes.
what we're
Kiana, your mic
really
is rubbing.
after.
Pull
It's
your
not making
necklace
some
away.
kind of transformation to someone you're not.
Exactly.
It's just getting that reset. That's
Exactly.
Yes,
Perfect.
but looking like you, not like somebody else. And Kiana, talk to me about you, your friends. First of all, if you don't mind me asking, how old are you?
Girl.
Is that I'm going to put you on the spot.
I'm 39, and I'm
beautiful.
Thank you, I appreciate that. First of all, I'm black. I don't know if you guys know this.
Did not.
Right. So here's the thing. In my family, we do a lot of things. Like, my mom is very comfortable with me getting things, but she won't go under the knife. I got the bags under my eyes removed. I actually got my breasts reduced at 17 because they were big and I was uncomfortable. It was giving me back problems. So when I got that done, it was like, the doors of the heaven opened for me. It was an amazing thing for me.
You felt more comfortable,
Absolutely.
more confident.
My self-esteem went up. I felt more comfortable in my clothes. But more importantly, the reason why I mentioned I was black, we have a tendency of thinking because we're African American, we don't age as fast. So my mom's answer is put a little Vaseline, a little olive oil, and some water,
all natural,
and some steam,
Yeah.
and you'll be okay.
And some steam.
Right. But see, we live in a rough, our environments that we live in now, the toxins in the air.
Yeah.
It affects our skin. So
Sure.
I'm always scrubbing and using different potions, but I am not going to shy away from the knife, okay?
Yeah. And see, now, I love that you're saying that, and I'm with you. I'm Italian, and being in this business, I mean, I have a bruise over here from, a common procedure, just getting some needling to tighten up the skin. I was like this on Friday, and my husband's like, stop, leave yourself alone. But then you have the pressures of being in this business, so if
Right.
I don't do anything,
Yes.
then eventually maybe they'll be like, God, Christine looks too old to be on camera.
Right.
But if you do too much, I remember one time I did Botox, and I think it was too much. A male viewer was
Right.
like, leave yourself alone.
But they also
so where's
don't,
the
they
fine
don't-
line?
They don't understand what we're dealing with in this industry. We're under a magnifying glass all the time.
Right.
You're too young, too dark, too light, too this, too that. So we're all the too much of something or not enough of anything, right?
Right.
So we're working to compete.
Yes.
So the girls are getting younger. Their breasts are perky.
Yeah. But I want to turn to them now
Yes.
because we're talking about us being in this
Right.
industry. What about the people you guys see who are just normal, everyday housewives or working women, and men, by the way?
Yes.
What are their reasons
Well,
for
see,
doing
this is the point that I would pick up on. You guys maybe see it to the extreme because of the industry that you work in, but everyone is under these pressures now. We have a very youth-oriented society, and it's across all kinds of fields, and it's within the social strata that people work within as well. So my patients, the most common thing that I hear is, "Hey, doctor, I just don't look as good as I feel any longer. Help me get, to that point." This is
look as good as I feel.
Yeah, because
I love
I would never thought
and
that.
and we're all about promoting good all-around health and wellness. I mean, we have known for years that our patients who do the very best, there you go.
Where's my gin? Where's my gin drink? Where's that thing?
There's nothing wrong with that. Leave the cigarettes alone.
Yes, no
That's-
cigarettes, Lil.
What?
Because she went like that. That's what, she doesn't. She was kidding. She
I've
was
never
kidding.
smoked a
She was kidding.
Good for you.
But listen, and
Good for
Lil,
you.
what are you hearing? Because again, we're talking to two people who this is your business. Are you hearing the same kinds of things from the women that are coming to see you? I see your clientele, by the way. They're beautiful, and I feel like they're mostly, what age would you say? My age, 40s all the way up, or even younger?
I would say 40s all the way up. We do acne on younger people as well. The beauty of what we're doing right now is 20 years ago, when I got in the business, you didn't tell anybody. And I remember being fresh out of skincare school, and women would come in, I didn't know, and they'd go, "I had this. Now, look,
It's out in the
I don't
open.
care. I did. And also, Christina, I wanted to say that I sit at a desk when people come in with the sun beaming on me. And when people come in, they scrutinize me. And it got to the point where, like, it's just, how can they believe what I say if I don't look decent?
Right. No, right. But I mean, well, first of all, you do, and you always have. But it's also, like when you agreed to be on the panel, we put an email out. Lil said, I would love to do it because it's not just about getting things done. It's about living the healthy lifestyle choices as well. And that's what I know you advocate too. Yes, we do have our wine. I've had wine with you on occasion. I mean, we're living life. We're enjoying ourselves. But you're hearing, you feel the pressure, but what are you hearing about from the regular housewives or working women? What are you hearing then?
Well, mostly in my industry, it's the sun damage. And we're all about sun. We love sun. You can do it carefully. But it's the wrinkly, crepey skin. For instance, no matter what age you are, no matter how built up you are in your arms, you're still going to have the crepey skin at a certain age.
Sure do.
So you want to cover that up. But I know I go to weddings and we don't wear pantyhose anymore like we used to. And I see legs covered in brown spots, and the face is beautiful. The biggest thing that we send are Botox. They want Botox for that hard muscle. And they also just want to get rid of this sun damage.
Right.
And
Yeah, because it show. I mean, in all the pictures now, it's you're like, oh wow, I shouldn't have been baking with Vaseline or with baby oil or those kinds of
But
things.
we can get rid of it. I mean,
Right.
the doctor can do the laser. You're so fortunate.
No, I want to ask something because we only have 2 minutes, and I want to get you all your opinions. When we were discussing this, all the producers, one producer in particular said, if you're happily married and you know that your husband supports you, no matter what, why are you doing this?
Because of
Start.
Go
and I
ahead.
want to go that way.
Happy to start. This is all about doing it for you. One of my primary criteria for patients is to make sure that what they're deciding to do with me, it's because they want to do it. It's not for somebody else. It's not about your husband. It's because you're trying to reflect the person that you truly are and the way that you feel.
That's what I told
that's
him.
the
And
bottom
the
line.
what about
spouse
you?
can be a great sounding board. I remember I was on Atlanta&Co several years ago, and he said, "What was with your eye?" And I said, "What? What?" And he said, "It was all jacked up." And I looked, and I had gotten a little too much Botox.
Yeah.
That wasn't the doctor's fault.
Right.
If I get bruising, I don't blame the doctor.
Sure.
That's one of the things
The
that can
risks
happen.
that you take, yeah.
Right. And so the next time I got Botox, little less, doc. You
Yeah.
know.
But
And
you're doing it for you.
I do.
And Kim, what would you
Absolutely.
say for which people that go, if you're happily married or in a relationship, why are you doing it?
Honey, you have to compete. You know, I'm sorry. I do understand what you're saying. I definitely think you should do it for you to make you feel more wholesome about yourself. But your husband, your sweetie, your poo, he has to like who he's looking at. And you got to be competitive, honey. These girls are coming into the world with perky breasts and butts and face don't move. They got all the edges. Their hair is beautiful.
Yeah.
How you going to compete with
See?
that? And you sagging at home. But he loves me. No, he don't, girl.
If this doesn't answer that certain producer's question, I said,
Pick 'em
look,
up.
yes. I mean, it's just like you said, but it's about, doing it for yourself, not for anyone else. And I think that that's what it's all about. But, we could talk about this for an hour. and I hope
forever.
Sure.
Jowls aren't pretty.
No, they aren't. And but you also want to look like you and want to
Exactly.
age in a way that people say you look fantastic. I don't know what you've been doing with your life, but you look great.
I
And-
have an 80-year-old aunt, and she says to pick up the jaws, all you have to do is this. I'm like, Auntie, I'm not going to walk around doing that. She was like, I promise
Right.
you, it's going to pick up your breasts and your cheeks.
Exactly. Look, we're going to go into the commercial break doing that. Coming up, we're giving you a spa getaway, and we're going to have a lot of fun.
Come on.
Yeah.